Okay, so we are live. Uh,
Okay.
so, uh, Hi everyone from wherever you are joining. Thank you for joining this session. Unfortunately, because of some technical issue with the Restream app, we had to switch back to this another StreamYard. So, sincere apologies for that. So, along with me, we have Thavaseelan. This is a good friend, my batchmate, but more than that, despite having a very, I would say, illustrious academic as well as corporate background, he chose to join the civil services. And at present, he is based out of Nagaland and has been doing tremendous, great amount of work, which was acknowledged by IIM Ahmedabad also, wherein he was also awarded the Young Alumni Achiever Award. And from the perspective of a country like India, where let's say even most of the population is can be classified as middle class, education and healthcare are very important elements, and not just for middle class, but even from the policy perspective, education and healthcare are very important areas where government emphasizes a lot of effort, puts a lot of emphasis in streamlining activities, reducing cost, and uh, taking the services and the facilities to different nooks and corners of the country. Fortunately, in the present capacity, present role, Thawasilan is handling both these areas for the state of Nagaland. So thank you, Thawasilan, taking out time from all the busy schedule and joining here.
Thank you, Siddharth, for your kind words. It's an honor to be on this forum, and look forward to a wonderful interaction, and hope all your audience find it useful.
Thank you, Thawasilan.
Thank you.
So,
Thank you.
I'm from northern India. You are from southern India. The way I compare north and south is southern is very economically as well as education is concerned, bit ahead from the northern side of India. And as far as even on various economic indicators things are concerned, it is better. I have was born in UP, brought up in Bihar, and from these two states, as far as aspiration to jobs is concerned, UPSC and specifically IAS is a dream job. But in the southern side, since people are economically well off, people have exposure outside India. Government job, of course, has a lot of competitive, you can say, career options. So, being having such a great academic background and also worked in very good corporate entities, what led you to choose UPSC?
I think this was something that I always wanted to do, Siddharth. I mean, my uncle is also in the IAS, so I've sort of grown up looking at him, the kind of work he's done. I think at the end of the day, with all humility, one of the things about this job is that the number of people whose lives you can touch on a daily basis is given the scale, at which our country operates. I mean, with the most populous nation on earth, so it's enormous, and I think making a difference in people's lives, the kind of satisfaction that it brings, I don't think there's anything else that could possibly come closer to that. I think it was for me that was a primary driver behind looking at the IS. That's something I always wanted to do. If you look at the kind of people who are coming in right now, I mean, most people who come into the services have excellent academic credentials. A lot of them have given up careers in the corporate world, and they're joining the IAS because, or any of the other civil services, because the kind of the canvas that it gives you in terms of making a positive impact in people's lives is enormous. So I think both these reasons, the exposure that I'd gotten earlier on to the services, as well as the satisfaction that comes with it. I think two major reasons why that drove me to
Okay.
join the IAS. Yeah.
Okay, thanks for that. Now, you were working in a corporate role, so and along with that, you took preparation efforts for UPSC. Of course, it is one of the toughest exams to crack. And rather than aptitude, you have so much volume of content, or you can say syllabus to cover. So, how did you go about preparing for it? And then couple of strategies, maybe if you could just share with the audience.
Sure. I think it ultimately comes down to time management. I mean, this exam, I know the syllabus is so vast that there's no sort of, there's no starting point or no ending point, because it virtually can ask you anything under the sun. So it would eventually boil down to how driven you are, how strong is your conviction that you want to join the services and then give back to the society. So that's one part of the equation. The other is just making smart use of your time. I mean, by the way, I wasn't I did do a fair amount of work on managing my time effectively, but then given that the working hours in the corporate sector were very long, I sort of couldn't couldn't do it to the level that I wanted to. But then all's well that ends well. But then so the key would be managing both your priorities. With your full time work, you can still put in 2, 3, 4 hours every day. You can squeeze in time wherever you can, and then you'll be able to crack it. Because I think one of the blocks that hits people as far as this exam is concerned is that they a lot of people enter enter the preparation assuming that this exam is very tough and it's not easily crackable. I think that creates a mental block in many people's many aspirants mind. So I think that is an error. You'll have to take it on the floor, because everyone else who's also taking the examination along with you is facing the same odds. And ultimately, what would make a difference is the process that you follow. So it's just best to focus on doing what you're supposed to do on a daily basis, and then forget about the results. The results will automatically take care of themselves. So it's about smart time management and how strong is your conviction. I think both of it will sort of help
Uh,
you go the distance.
Wonderful. So it's almost taking a leaf out of Bhagavad Gita, Karmanyavadhikaraste ma phaleshu kadachan.
Absolutely. I
So
mean,
put
that,
the
that
efforts.
guides everything in life.
Wonderful, wonderful. So I remember correctly that along with many cases, and it is not just for IS, even let's say when people get into IIT, people get into IIMs, they think that okay, now they're set for life. So as far as paying attention on the academic program is concerned, while people go through the training, people have get into a bit of a lax approach. But you were also very active there. You received a award also. So what drove you to maybe continue that same academic rigor? Once you were into IAS, of course, you were into the IAS. I don't think the post selection academic impacts anyway to the services. So what led you to have that drive?
I think a couple of things here. One is, I mean, there's a reason why you got into the services, right? I mean, if you're not able to impact people's lives positively, then there's actually no point in you having gotten into services. For me, the way I look at it, I mean, since you talked about the Gita, I'll just extend on it. I mean, it's absolutely you can just focus on your efforts, the results. You have no control. On the other hand, for me, it's like if I'm not doing what I'm supposed to do after getting into the services, it's sort of a bad karma that I'll be accruing if I don't do what I'm actually supposed to do, because you've been given this opportunity. There's so many other people out there who are far more brilliant than you, far more capable than you, but who don't get this opportunity to serve in any of these services. So given that God's been kind and has given you this opportunity, if you don't make the most of it, and if you're not able to serve people, that's what you're primarily supposed to do. It sort of defeats the whole purpose. So that particular point, not losing sight of what you gotten into the service for, A, and B, I think, I mean, if you let laxity to set in, no matter which career you pursue, it's not something that's ideal. So you'll have to sort of
Agreed.
keep reinventing yourself, keep reading, keep learning. I mean, things never stop. You can always keep optimizing yourself on your personal front, on your professional front. So I think you that will never stop. You'll have to keep pushing
Great.
yourself every single. Yeah.
Great. No, thanks for so fortunately, if it gives us a lot of comfort. So in case I see it from a citizen perspective, that people in the policy making they keep themselves very updated, and then that kind of drive. So it's really good to see that. Now you have worked in various roles. District also now handling a very two important areas. So among all these, what has been the most satisfying? Couple of course, there would have been so many of them. In case you have to talk about couple of most satisfying work experiences where you really felt that okay, you made a difference.
I mean, every role is special, and every role that you handle is close to your heart. So I can't sort of specify one, but then since you asked me a very pointed question, I mean everything is a pretty satisfying role, and it's up to you to make it
Agree.
satisfying. It's your effort that would ultimately matter. But then if I were to point about one particular instance, it would be during COVID. I was a collector of a district called Mon. Mon is in the northernmost part of Nagaland and one of the most backward districts there is. We have a very long border with Myanmar, and is currently the most populous district in the state. So I think our ability to handle COVID, touch wood, we were able to. We only had about, including the second wave, we only have about had about 10 deaths. So I think we
Okay.
were able to contain the situation pretty well, given the fact that we had the largest number of returnees coming back to Mon amongst all districts in the state. I mean, barring the Dimapur and Kohima, where inherently, I mean, it's a multi-tribal district, both Dimapur and Kohima. Then Mon, given the infrastructure, it's extremely backward. One of the most backward districts in the state. We could manage it pretty well, and I think that perhaps would be the most satisfying, task that I'd undertaken till date. Driving my district through the pandemic without much damage. I think I'd call that the most satisfying part. Yeah,
Okay, wonderful. So
yeah.
I was just interacting with another IM alum. He's much junior to our batch, but very active. He's from UP cadre. He's also though from Delhi, and he reached out to the alumni committee in terms of trying to build a linkage with the corporate CSR funds to activities. When I read about your this alumni Young Alumni Achiever Award, one of the aspects was there which you could successfully build maybe linking the CSR fund to maybe the activities with let's say in the district or various places in the state. What strategies did you utilize? And then apart from that, what other activities where which led you to have this award?
Sure. I think so. When it comes to CSR, it all started with COVID. I mean, prior to that, we were in fact reaching out to a lot of corporates, but then we did not have much success. We did have some success, but then not at the level that I'd wanted. So post COVID, we'd gotten connected with a lot of NGOs who were offering the help of various kinds, from helping us. I mean, there's an entire spectrum of things that we could do, from helping us with equipments, oxygen concentrators, helping us with contact tracing, and there were a whole lot of things. And all of these organizations, some of these were corporate, some of them were not-for-profit organizations. They'd reached out. So what essentially happened was, when we started working with one, and they'd seen the kind of comfort that they had, the ease with which they could reach out to the administration, the police, and the government officials. So they sort of started referring more organizations which were working in the space, and one thing led to another, and we were able to make a significant difference primarily in terms of the healthcare infrastructure, the district hospitals, the primary health centers, the community health center. So all of them, the sub centers, we were able to. One of the organizations, it's called the Selco Foundation. So they're based out of Bangalore. One of the things that they'd done was, we connected with them during COVID, but then the work continued much after COVID as well. So they had electrified they'd put in solar panels in all the health units, so that it's
Okay.
24/7 right now. I mean, so one of the problems, as with most backward districts, is that the electricity is not very regular. There used to
Mhm.
be long hours of power cut every day. So, and when you have a situation, when you have a remote health center where there's someone who's coming in from an extremely remote village for a delivery, and if there's no electricity there, it's an extremely unfortunate situation. So that was one intervention that had happened. We were able to. So Selco Foundation also helped us with a lot of equipments in many of these hospitals. We worked with REC, which is Government of India organization. So they had, through their CSR, helped us, equip the district hospitals with advanced equipments which were not part of the standard issue of Government of Nagaland, because Nagaland is a resource crunch state. Most states in the Northeast are resource crunch, have resource crunch, so because of which you sort of, you couldn't have every equipment that you possibly wanted to. The doctors were equipped, but then were equipped to use the equipments, but the equipments were not there. So this was something that REC had helped, and the Indian Oil had come in and helped us upgrade the infrastructure in two of the community health centers. So multiple organizations, private as well as government, had stepped in and helped us primarily work on the healthcare infrastructure. There was some efforts in livelihood, some efforts in education, but then by far the most impact we could make was in the area of healthcare.
Okay, okay. Now, you have, of course, been keeping track of that a lot of activities are happening with so-called artificial intelligence. Even though telemedicine and such kind of maybe utilizing internet and such tools to reach out to various places in the country and specifically in the remote parts of the maybe let's say districts in particular states. Uh, in the age of AI, what is your opinion, given that you have breadth of experience in the governance? How maybe let's say AI can be leveraged, and what potential do you see there?
So I think the two things here. One is, what is the sort of impact that's going to have in, say, education or healthcare? That's something that's still evolving. We do have some clarity. Say, for example, in healthcare, we worked with an organization, the district hospital there, which helped us in early diagnosis of TB. So someone had to, if they come to the hospital, they just had to upload their X-ray on a particular app, and someone would they had this algorithm, artificial intelligence based algorithm, and then they'll come back to us saying that, okay, what's the probability of tuberculosis, because there were several false negatives as well. So that was just one very simple application when it comes to AI. I mean, the way things are changing right now, there's going to be tremendous difference that's going to happen in the area specifically of healthcare and education. So, as far as education is concerned, one of the things that we're working on right now is there's an organization which is working with us in terms of helping design learning pathways using artificial intelligence for students. So the students go through a set of content. They're evaluated. Once they're able to answer a certain level, then the questions become increasingly difficult. You sort of make them. Get even better at a particular concept. So this again fairly very early days, but then there's going to be tremendous impact in terms of how uh, specific areas like healthcare or education are going to be affected. On the other hand, when you look at how easy it's going to make a life for us in the civil services in terms of better aid our decision making, make us more efficient in our day-to-day work. That again is something that's early days, and we've not seen much happening on that front as of now. But then I'm sure as time progresses, a lot of interesting things are going to happen. I mean, in terms of helping those in the government execute their functions better. Um, uh, when it comes to their specific job, as well as the areas that they're working on, tremendous impact is going to happen in the nation. There's already happening, but it's
Sure,
currently still in the nation stage. Yeah.
sure. Now, you handle two very important areas, which I mentioned in the beginning, education and healthcare. And by several, I would say, views, in case these two areas could be maybe, let's say, access could be improved and affordability, of course, could be ensured, there could be a lot of transformational things happening in the country. With your experience of these two departments, what are various challenges which you have observed, and then maybe a couple of examples which you have seen that okay, these might work, and these maybe on a national level is also these things could be taken up.
So I think, I mean, I'll go with education first, and then I'll talk about healthcare. So I'm the principal director of school education, the head of department. So in Nagaland, this is the second largest department after the civil police. So now I think as far as our state is concerned, there are five broad challenges, focus areas for us, and this is broadly, would sort of apply to various states in different proportions, of course. The first for us is, I think, foundational literacy and numeracy, because the foundation is key. Now, if the kids don't have a very strong foundation, I'm talking about the government school ecosystem. So no amount of interventions at a later point in time is going to help them. So that is a key focus area for us. Government of India is there's a Nipun Bharat mission where which has been launched specifically to focus on foundational literacy and numeracy. There's still a long way to go. The challenges are multivarious. Right from having enough teachers in place and then ensuring that the teachers actually deliver what they're supposed to do in the best manner possible. So, foundational literacy and numeracy is one. The second is bridging the gap between what's necessary and what's currently there, both in terms of physical infrastructure as well as digital infrastructure. Now, most states they've been doing a lot of interventions in this over the years, but then similarly, Nagaland is no different. But then there's still a long way to go in terms of ensuring that every single school there is has the best possible infrastructure suitable to the enrollment there, because it's a chicken or egg problem. I mean, if you have good infrastructure, you have good teachers, you're going to have more enrollment.
Agreed.
Unfortunately, there's more kids in the private school ecosystem than the government school ecosystem. So the biggest challenge for us is pulling them back to the government school ecosystem, given that the teachers in the government schools are far more qualified and also much better paid than those in the private schools. Um,
Agreed.
so so this is the infrastructure gap is the second. The third challenge would be in terms of it's three things. So one is the curricular reforms, the second is the assessment reform, the third is the pedagogical reforms. You'll have to
Okay.
constantly keep updating your curriculum as to in order to suit what the kids need in the 21st century and beyond, right? So that's something that you constantly keep working on. You constantly keep upgrading, building your capacity of your teachers, upgrading their ability to deliver the pedagogy in the best manner possible. And the third is assessment. I mean, the national education policy, there's a very clear a shift from rote learning to competency based assessment. So this is something that absolutely has to happen, because one of the problems that we've had in the past is that most tests in the schools used to be whatever you're taught in class, the same thing gets repeated in the exam. That's not going to help anyone, and this is something that you realize after you finish school. So the third is a mixture of all these three. The fourth is so say a state like Nagaland, you don't have too many private sector opportunities, job opportunities. Most of them are dependent on the government, but then the government is also oversaturated. So we need to help kids become job givers than job seekers, start generating jobs in the marketplace. So there's a lot of increased emphasis on vocational education. How do you help kids become develop an entrepreneurial mindset? How do you ensure that they sort of create jobs going into the future rather than be dependent on the government for jobs? The fifth and extremely important again is inclusive education, because any kid
Okay.
who is differently able should have the same opportunities as a kid who is not differently able. A lot of interventions are happening in the space, but still a long way to go. So I think these are the five challenges, five focus areas for us. Every state would have one or more of these in different proportion.
Agreed.
So that's as far as education is concerned. Health, I look into one very specific aspect. I'm the CEO of the State Health Authority. So I manage two insurance schemes of the government. One is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which is a central government scheme. And there's a Chief Minister's Health Insurance Scheme, which is Nagaland's attempt at universal health coverage. So
Okay.
in this, I presume the biggest challenge would be in terms of increasing the awareness amongst people as to why. See, I mean, government is providing insurance. The key is ensuring that people start adopting a healthy behavior, because proactive health management is key. Preventive health management is key. You'll have to sort of else once you go down the road and you don't start taking care of your health, a lot of problems. You're setting up yourself for a lot of problems. So I think key is creating awareness and encouraging them to have a healthy lifestyle is what would be the single biggest challenge in all of healthcare.
Sure. So no, thanks. Thanks a lot for comprehensively and very structurally for talking about all this. And thanks for sharing a perspective for both education and healthcare. Now, So given we are at almost end of the session, in your perspective, given you have corporate as well as now governance experience, what's your advice to people who seek career in public service? Or even to people, because there is a lot of involvement of NGOs, civil society groups in supporting the governance, given that with its own infrastructure and maybe let's say people on the roll, government can do a bit, of course, only to an extent. And a lot of involvement has to happen from civil society and other element, other people. So, what's your message in case more impact has to be caused by people? And then, what is the kind of a reality check which people could make when they have to join, maybe let's say, who seek career in public service?
I think I'll split it into two parts. One is for those who are seeking a career in public service, and then those in the NGO civil society space. So for those who seeking a career in public service, please ensure that if there's a calling for you, I mean, public service at the end of the day is a calling. It's not something that could be. It might sound glamorous. It might seem glamorous from for someone from the outside, but then it's not really so. Ultimately, what matters is what drives you to be here. Because if you lose sight of the goal of helping people, that is not optimal at all. So please ensure that it's something that you're comfortable with, something that talk to other folks whom are in public service. That will give you a lot more sense of how a civil servant's life is. I mean, if someone thinks that it's just a 4 5 hour daily work day, it's a very different situation. It's extremely
Great.
long you know. The salaries, of course, in the government, they're not as high as what's in the corporate sector at any level. So if this is something that's at the end of the day, but then the satisfaction of making a change and touching people's lives on a daily basis, if that's something that drives you, then by all means this is something that you definitely want to explore. For those in the NGO and civil society space, I think a lot of them are doing tremendous work working in the government, because we don't have all the talent within the government. There are obviously
Agreed.
gaps, and there's tremendous. They can come in and they're bridging the gaps, and that's something that we experience on a daily basis. Right now, it's not a question of whether it's about co-working and creating the impact. It's not about, okay, you're in the government, you are elsewhere, so you can't do this. Absolutely not. I mean, the amount of value that they're adding is tremendous. And we work with a lot of organizations, and every single day, the kind of expertise that they bring to the table is just something that I'm very grateful for, and pretty much every civil servant would be. So I think I can just thank them and then ask them to keep supporting the government in whatever way possible, so that we can maximize the impact in people's lives. Yeah.
Thank you for showing that humility, acknowledging the efforts of different other elements who support the cause of the nation. Thanks, Thava, for being
Yes,
with
so that.
us and sharing all
Thank
your thoughts. And
you
thanks,
so much.
participants from wherever you have joined. Apologies for the brief technical glitch we had. And I'll be, of course, sharing the recording also again so that others who could not join because of maybe the link mismatch, they could also observe it. Uh, so I'm just ending the live stream.